Hi, I'm Dr. Bains at Jernigan's Hair Replacement Clinic here in Raleigh, North Carolina, and today I'd like to talk a little bit about female pattern hair loss. Female pattern hair loss is a common form of non-scarring hair loss that occurs in adult females. Female pattern hair loss is characterized by a progressive loss of terminal hairs in the frontal and vertex areas of the scalp. Unlike males, the frontal hairline is generally spared, and the hair loss in the affected areas is more incomplete. Commonly, this condition in females can occur anytime in life, but generally occurs after menopause. What is generally seen is a progression from thicker terminal hairs to thinner villus hairs, which reduces hair density. Proposed theories include increased sensitivity of the hair follicles to DHT or dihydrotestosterone and sensitivity to the hormone estrogen. With these theories, multiple genes may make one more susceptible to female pattern hair loss. In female pattern hair loss, one typical pattern you see is noted as the Christmas tree pattern, where hair is more sparse in the midline part of the scalp. These types of hair loss patterns may be denoted by either the Sinclair stages or the Ludwig stages. Also, what might be seen is thinning in the temple areas of the scalp. Again, with this type of alopecia, scarring or inflammation is not present. To make a diagnosis, you need to take a thorough patient history looking at the age of onset, duration, and type of hair loss that's present. Again, this is Dr. Bains with Jernigan's Hair Replacement Clinic, and I thank you so much for your time.